Hello, I'm Dr. Thomas Perry, President of the Integrated Benefits Institute. IBI is a national not-for-profit organization supported by more than 550 corporate sponsors. Employers comprise about 85% of our members. IBI's mission is to do the research that points the way to new approaches to managing health and productivity, provide the measurement and modeling tools to help employers get there, and facilitate forums that promote the exchange of new ideas and experience. Historically, employers have organized their health-related benefits programs in independent silos. Healthcare in one place, often with pharmacy benefits, EAP programs, and wellness activities as separate carve-outs. Disability programs typically are provided by a separate corporate entity, and workers' compensation often delivered in yet another part of the organization. Other types of health-related worker absences often haven't been managed at all. In support of this benefit structure, employers have turned to the market for best-in-class vendors in each of these separate benefits programs, typically with a goal of controlling individual program costs. The result is often a patchwork quilt of loosely fitted programs held together with fraying thread. But as every employer knows, these programs often target the very same people. In the words of one employee, "When my company carves programs out, I feel like I'm being carved up." It is this perspective that is leading many employers to take a more holistic and integrated approach to managing the health and productivity of their workforce. They desire to integrate their health, absence, and disability-related programs with a more focused strategy. As employers move in this direction, they can't help but turn to the marketplace and ask, how can I get my vendors to follow me in this more integrated approach? We'll address this question in today's program through a conversation with Chris McSwain. In his work, first at SCANA and then at Whirlpool, Chris has led the way in developing innovative strategies that transform vendors into true business partners. He will discuss how those two organizations have been able to coordinate their vendor efforts to improve the health and productivity of the workforce. This DVD has two parts. The first is a discussion of key strategies and how to better coordinate vendor programs and activities. The second is an overview of the tools that can help in this transformation. These tools can be downloaded directly from this DVD. Before we begin, I'd like to thank Chris for taking the time to share his experiences with us today. I'd also like to thank Johnson & Johnson Healthcare Systems for their generous financial support of this program. We hope you enjoy it. Chris, thanks for joining us. When we started IBI 15 years ago, there were at least half a dozen suppliers that provided everything: group health, disability, workers' comp, behavioral health. Now there are none. In your role in managing the benefit function, supplier management must be a key part in your job. So what guides you in the way you approach supplier management, and what are your beliefs about that?
Well, Tom, it's going to be great to discuss this with you today. Really my personal mission is to invent success every day to help before it hurts. I really think that describes most employers and our suppliers as well. I think we all want to do good by our employees while we're doing good business. But this provides a challenge for us to always want and need to improve that I think drives most teams to want to pierce the veil of the status quo. And really we have to be successful because incremental improvement, I think, is a fatal strategy and frankly just not good enough. Disrupting through innovation is a key way that employers in particular can drive breakthrough results and high performance levels. And I think that's one of the reasons why supplier management is so important, is because it's one of those things that employers can do. It's within their control to really drive those breakthrough results and high performance level. I know personally that supplier management can change lives and drive business success, which I think is an important mission for everybody to achieve. Although supplier management is core to our total health and productivity strategies as an employer, unfortunately, it's not a core competency of many of the benefits teams that I know of. Now, I've been fortunate to be a part of two benefit teams that have made a great deal of progress in our supplier management strategies, and I'm thrilled to have the opportunity to tell you a little bit more about that and share with you and our audience more about why supplier management is important and how, as really the goal of our discussions today, employers can quickly embed and implement supplier management as a core competency within their benefit teams, regardless of whether the organizations that the benefit team supports is a small, mid-size, or serves a larger employer base.
What are some of the key issues that an employer has to address in managing multiple suppliers to support its total health and productivity goals?
Regardless of the employer size, the success of the total health and productivity strategy to really create and sustain a culture of health is very dependent on how well the employer and their suppliers work together and perform to improve the health of the workforce and all the covered lives while delivering great value. Obviously, the more suppliers that you have, this becomes very complicated quickly. And in particular, high-performing employers are doing more than just basic services with their suppliers. They often have invested in on-site support and resources, which can greatly increase the number of suppliers. But there will be really three main issues that we focus on in our discussions today, Tom. The first is on the employee experience. The second is waste in the system and how to improve that. And the third is understanding and working through the differences between vendors, suppliers, and partners.
Chris, we hear all the time from employers that they want to engage their employees in their work and in their health. How does the strategy you're outlining today affect the employee experience?
Tom, for this to work successfully, both the strategies and the operations of our suppliers have to align and be integrated. They have to effectively work across the silos that they represent and work in a very integrated way with the employers that they're serving. This all has to happen to deliver the maximum value to our employees. And I have this described in a chart that I'd like to talk to you a little bit more about. On this particular chart, it shows a typical vision and total health and productivity strategy. Develop a culture of health. You see the central target of the strategy is the employee experience. That's why it's one of the most important issues within supplier management. As you look around the employee experience, you see a compilation of a lot of different services, all oriented to see that total health and productivity vision accomplished and delivered. Behind each one of those programs and services is at least one supplier. Now, for us to have an employee-centric experience, all those suppliers have to work in a very integrated and synergistic way. The arrows at the perimeter of the circle here denote the integration and the synergy that has to exist between all of the suppliers to make the total health and productivity strategy successful, which delivers a terrific employee experience, which ultimately drives the development and sustainability of a culture of health, which is, of course, the vision that we're trying to see realized here. You see, Tom, with a poor employee experience, the information that the employee or family member receives may be confusing at best and conflicting at worst. Whenever this happens, the value of the investment that the employer has made in those programs and services is greatly diminished. When that value is reduced, the ROI that the employer gets for these investments is also greatly lessened. And that's why it's one of the large issues that we're going to focus on today, the employee experience.
During the healthcare reform debate, there was a tremendous amount of discussion about reducing waste in the system. How does your supplier management strategy affect waste?
Yes, Tom, this is one of the areas that effective supplier management can help employers. And frankly, if we do it right, even our country. The delivery of healthcare includes several supply chains to deliver health outcomes for the benefit of our employees. Now, a supply chain would be simply a system of organizations, processes, resources, people, all to take a product or service and move it from a supplier to a consumer. In the healthcare benefits supply chain, this creates the issue of many silos of all these different suppliers having to try and work effectively together. And whenever we have a lot of silos, we find as employers it produces a considerable amount of waste.
Chris, you've talked today about vendors, suppliers, and partners. When does a vendor become a supplier, and when does a supplier become a partner in your experience?
Well, employers often use these terms interchangeably, but really there are some very distinct differences which we're going to talk a lot about. And even when you think about it, when an employer has one supplier that may have multiple services bundled together, that one supplier may actually, depending upon how they're performing in those different areas, look like a vendor, a supplier, and a partner. it can be real confusing. And I think these next few charts are really going to help us. Let's go through them one by one. We'll start with vendor, learn more about how that's described, and then build over these next three charts between vendor, supplier, and partner. Starting with vendors, we see that we have somewhat of a silo focus, very tactical thinking and approaches, limited innovation, and very minimal levels of customization. As we transition to suppliers, we see that they have multiple silos, but they tend to be much more effective in working across those silos. They can be very strategic instead of tactical. I have found them to be open to innovation and listening to ideas coming from the employer, and that they have the beginnings of a ROI sense and perspective, and also a strong rootedness, if you will, in measurement. And that you're beginning to see their programs being customized. The employer just doesn't have to deal with what their box that they bring to you supplies, but rather they're willing and able to be flexible enough to work outside of the box on occasion. But the real destination that we'd like to see all of the marketplace eventually evolve to is the partner space. These are very clear and easy to spot, to me the easiest of the three, because they own the problem. They understand what your strategies are, and they help you own the solutions to that. They tend to be very consultative in nature and helpful in trying to provide ideas and input about how you can make a difference for the people you serve. They have a real focus on innovation because they understand that that's their lifeblood. That's where they're going to progress and help others within the marketplace. We often see partners moving away from participation-based focus and moving much more towards outcomes-based. What difference have I really made? And then they tend to be very proactive. They come to us often having met with each other for the benefit of the employer to suggest proactive strategies that the employer should consider in driving change and really looking for those breakthrough results that I talked about earlier. You know, Tom, at this point, having seen these differences, I hope that employers will take just a moment or two and reflect of the people that they're working with. You know, am I working with a vendor, a supplier, or a partner based on these differences? And if you're a supplier in the audience, I hope that you take the same measure of whether you think your clients are perceiving you as a vendor, a supplier, or a partner, and how you might do better in serving them going forward, regardless of how you're viewed.
How have you found supplier management fitting into your total health and productivity management strategy?
Well, an effective supplier management approach is a critical component of the total health and productivity strategy and a critical success factor for the benefits team. But unfortunately, what we find is that for most employers, they haven't had the resources or the time to really invest in their processes and even the tools that they might use to accomplish that critical part of the strategy. But to be clear, what we're really talking about here in management under supplier management is it encompasses a broader strategic look rather than just the operational perspective that many suppliers provide in their programs and services. And to give you an analogy, what we're doing in the health area is no different than what we do already in other parts of our business. That's why this shouldn't be so hard. We have suppliers in other parts of the production part of our manufacturing business where we expect our suppliers to come together, cooperate, work across silos, and in a synergistic way help us in developing and designing the products and services that we might use in the production area of our business. You know, from my experiences, suppliers are not going to change by choice. You know, they need an employer to come behind them and help them understand the criticality of thinking differently and making this transition that we just talked about from vendor, supplier, to partner. And there's, as I said, there's no one to come behind us to really do that for the benefit of our people. So our employees need the benefits team to do what nobody who can come behind us could possibly do, and that is to help our suppliers really perform to the best of their capabilities, hopefully at the partner-like level. And Tom, a final point is that done right, with all the hard work that is absolutely required, I do not want to be shy about mentioning to the audience that this doesn't happen without a lot of investment and a lot of hard work and intention to do better. But done well, effective supplier management can help us with all three of these major issues that we've just spent some time discussing: the employee experience, removing waste from the system, and effectively transitioning vendors to become better partners over time.
Chris, what was the landscape those suppliers covered? What programs were actually involved?
Well, Tom, if you go back to that chart that we showed earlier of the total health and productivity strategy and begin to think about the different services that were constructed there, you could see that we had the group health plan, we had a pharmacy benefit manager, disease management, behavioral health through EAP, absence management, which of course would include short-term disability, long-term disability, FML, workers' comp, safety, on-site resources. And that's just sort of the beginning of the typical cast of suppliers that an employer, small, medium, or large, would be working with. But actually it gets even a little bit more complicated because when you think about the group health plan, within that one term you could have high-cost claims management, care management, and utilization management services. When you consider one of the emerging trends across the country is the greater prevalence of the patient-centered medical home and accountable care organizations, you begin to start seeing programs and services migrating into the community, all of which increases the number of suppliers. But that doesn't really do complete justice until you start considering some of the other suppliers that a typical employer would have to work with, but maybe not normally think about as a supplier. So for example, who's providing the executive physical? Who handles the life insurance, dental, vision? What about the account-based plans? If you have a health savings account, you have banks you have to work with and a provider in that regard, or the HRA, or the flexible spending account may typically be a different provider in addition to that. But what about the cafeteria? What about the 401k third-party administrator or the company that you work with to administer your pension resources back out to your retirees? The landscape can get very broad very quickly, but this is a day in the life of the average employer. A final perspective is that depending upon the employer's geographic footprint, the landscape can get very complicated even further based off of how much coverage they're having to provide across the U.S. And then finally, the bottom line here is that employers really have to invest the time and resources to truly understand all the suppliers that are servicing their health care benefits supply chain.
How much overlap was there across the suppliers with which you worked?
Tom, overlap is an area that we have spent a great deal of time trying to better understand. But let's start with the overlap that exists when multiple suppliers are present to be able to treat a single chronic condition. And to really help us get a perspective on how complicated this part of our mission is, one of the IBI tools, the HPQ Select, was particularly helpful for us. The chart that we're looking at now shows the data for 130,000 employees. And as you look at this data, only about a quarter of the people have no chronic health conditions. But if you look further, about a third have 4 or more. That sort of paints the picture of where the two boundaries are. But I think it's clear to see that this isn't about treating a single condition. Most of the people that walk in our doors as employees each day are carrying with them several chronic conditions. So although employers and suppliers speak about this in the singular, like we'll say a certain percentage of the workforce has diabetes, in reality what is really true, and the IBI tool here really helps us to understand clearly, is that most people walk in with something not only with perhaps diabetes, but often 1, 2, 3, or more different chronic conditions all at the same time that they're having to deal with. So, Tom, as we've clearly seen here, it's very complicated for the employer as they manage the health of the population. But just to simplify this, let's talk about one chronic condition and talk about how multiple suppliers interface related to that one condition. And depression might be a good example here. Most employers will have an EAP. They'll have lifestyle management, disease management, and potentially even the pharmacy benefit manager, all providing services and support of somebody with depression. But let's think about that person for a moment, because by the way, health is personal. We have to put our people in the center and focus as they move through the system that we as employers construct through all of our suppliers. So if I'm a person that may have that condition and I interface with one supplier, but based on my level of need, I should actually be served by another, how's the employer going to know that? How's the supplier going to know which supplier the employee should be working with most directly based on their need? This is why employers have to invest the time and resources to go much deeper than just purchasing the services and hoping that everything is going to work out for the benefit of the employee to have a great experience. Typically, those 4 suppliers that I'm talking about works within their own silo, and it's really, they don't think very much even about how to transfer somebody to the next supplier. Maybe as an employer, we've made it difficult for them by the way we have constructed our performance guarantees. We have to be sure that the performance guarantees that we are putting in place actually acknowledge and reward them for doing good things by transferring our employees or a family member to the right supplier. And the employer has to drive these interactions through effective supplier management. You know, up to this point, the employers in the audience may be thinking that this is a very complex and challenging set of circumstances for them to have to navigate and manage. And in reality, it is, and I'm not backing away from that. But I also want to paint a picture of how easy it is to get started. Let's take this one situation, 4 providers treating the same sort of condition. You know, your success in your journey as an employer can really begin by simply asking your suppliers to exchange information about their services with the other suppliers. So you take that first step in helping the other suppliers become educated and knowledgeable about what's available from the different suppliers that you as an employer are paying and have invested in delivering quality care and services to your people. I've seen this work, and it is not complicated, and it's easy for employers to get started. But it's a long journey, and there's much more for us to discuss about it.
What about gaps in care? What was your strategy to work with multiple suppliers to close gaps in medical care?
Wow, that's a great question, Tom, and a real challenge for employers, because I'll use a few examples. We had a supplier that came to us very excited about a new product and service they had created around gaps in care. And they said, you know, we're going to take data from another source, combine it with ours, and produce these really targeted messaging for your employees that we think is going to add great value. And we were very pleased. And then we asked them a couple of questions and said, you know, as you know, we have another supplier that gets your information and data and has their own gaps in care and communications, which you're familiar with. Now, in creating your product and service, did you at all communicate with them to be sure that they were aligned and synergistic so that our employees are not getting conflicting or confusing information? And honestly, they kind of put their heads down and said no, that they had not. And that, frankly, that had been, should have been actually captured in the ideation phase of what they were doing. And I give you that example to illustrate, one, how important this area of gaps in care really is to the total health and productivity strategy, but also to illustrate how much in silos, much of the suppliers still work, and how for employers to really get the maximum ROI and for employees to get the highest level of value, employers have to, through effective supplier management strategies, really understand what it is that they're purchasing and how it's working effectively together.
Chris, we hear all the time from employers about needing actionable items. How does your strategy actually create action items that you can implement?
You know, Tom, in an effort to better understand our benefits healthcare supply chain, we've done several things to put it in more pragmatic terms. One of those things is to spend much more time and effort to really understand the data exchanges that occurs between our suppliers. And in this chart that we've created that we figuratively call the yarn exercise, this came from one of our supplier summits where we had a person in the middle that took one end of the yarn and put it in the hand of the supplier who was sending data, and we took the other end of the yarn and put it into the hands of the person who was receiving the data. And we did this several times, and it was amazing the things that we learned. We took this picture, and just so the audience would know, we didn't complete our work here. We stopped with a considerable effort left to go to complete the process, but at that time we had made our point to all of the suppliers in the room about how complicated this is and what a critical role that they play and how they have to come out of their silo to truly have a terrific employee experience and reduce waste out of the system, and really to be a more effective partner in the process. But I can tell you, as a team, we were also learning a great deal by seeing where all the strings were going.
How did you deal with overlap among your suppliers for the multiple chronic conditions that exist in your workforce?
You know, Tom, the yarn exercise that we just went over was a very helpful and a good beginning, but it made us realize that we had to go deeper. So, Tom, the next step that we took based on the yarn exercise was to better understand the overlap among our suppliers. We took our top 5 chronic conditions as identified from our data. Everything should start with the data. And we created a matrix that for each one of those 5 chronic conditions, we listed out our major suppliers. And then we contacted each one of those suppliers and asked them, what is it that you believe you do in support of each one of these 5 chronic conditions? And what we found really surprised us, because there was hardly a single cell in that matrix that did not have an X in it. So again, an insight for the employer was that all of our major suppliers thought that they were all involved with our chronic conditions, which created a lot of concerns and even questions about what the employee experience must be like for our people if all these suppliers are all trying to help with the same chronic conditions. So we took a step back and decided that we wanted to approach this a little bit differently. And we created something called the supplier workshops. What we've done is invested our thoughts around what are some of the most important touch points that we as an employer should focus in on. And this is a pretty big problem, and you can't try and eat the elephant in one bite. So we have to figure out, where do we want to start? Well, one area that made sense for us based on our total health and productivity strategies was with the absence management process. We think that the absence management process should produce a greater value with a focus on return to health rather than simply a return to work. So there's a tremendous opportunity in the touch points that exist within the disability process. So we brought our absence management supplier and our health plan supplier together with our employee benefits team to discuss the disability process and how, in pursuit of trying to achieve that return to health, how the health plan could be helpful in supplying information to the absence management supplier to add greater value for the employee when they called in, and also for the family member that's connected to them.
How have you organized those supplier summits?
Well, they certainly are a key part of our success in our supplier management strategies, and we've had some fun with them. You know, I'd like to walk you through a little bit of a recent one where we brought all of our suppliers together. This would be the health plan, the pharmacy benefit manager, our absence manager, vision, dental, all the major suppliers we had together. And what we did is we divided them up into groups, and we gave them each an employee scenario to give us some feedback on. So let me walk you through what that looked like, Tom. In this particular scenario, a person calls you who actually has a vision question. In the course of that conversation, they also tell you that they're suffering from diabetes. And then while they're waiting for you to give them the information that they've requested, they also begin to tell you more about their personal situation, that, you know, they're struggling to pay for their finances and they also have the added challenge of dealing with an elderly parent and helping them support their needs. And they also tell you that they're from your town, Ohio. So we ask everybody at the table, now that you've taken that all in, what are your next steps? And we actually gave them a few key questions to answer. So for this particular scenario, we asked them, would you support that individual just with their vision needs and questions and then go on to the next call? Or would you go deeper? What sort of integration opportunities would you contemplate? And how about the other services that you know are available through your knowledge of the other suppliers that our company utilizes? And how would each supplier handle the situation? So we made each supplier talk. Would you handle it different than your neighbor? And how so? And would the employee be the only person that you would try and serve? What about the spouse or the family member? And the conversation that we had was absolutely astounding. I would say that it would be a understatement to say that many eyes were open, because really for the first time many of our suppliers were beginning to learn about the other suppliers and the services that they offered. We actually saw laptops come out and said, hey, let me explain to you about what I could do to help in this particular situation. So a lot of progress was made. But one interesting facet that I think the employers need to know is that, ironically, the person in the room who knew the most about all of the capabilities of the suppliers was the employer. And we found ourselves going from table to table, knowing what we did, and making sure that the supplier whose services we might have felt were not being discussed in the programs that they offered that we were valuing, that were actually acknowledged and described to the other suppliers. So we forced some conversations to happen that because the suppliers, all good people and good intended, so used to being in silos and operating in that somewhat of a constricted environment, we're finally breaking some of those boundaries and restraints and doing things for the first time. So it was a little harder for them, but they got more used to it as that part of our program went on, and really great conversations resulted as a result.
Just so we don't sugarcoat the supplier management strategy, do you have some examples with less than a happy ending?
Tom, that's a good and fair question. I have a good example for that. You know, sometimes an employer has to go to great lengths to see their total health and productivity strategies be successful, and up to and including changing suppliers. An example that came recently is in the area of our incentive plan design. We knew we had a leading edge incentive design, but it was complicated. It required several data sources going through a single source. And we were told by the supplier that we had planned to work with two things. One, that they couldn't do it, and two, that they didn't think it was the right thing to do. And trust me, I always like the open and honest dialogue, but this is something that the team really believed in. So we knew we had to make a change. And we did move to another supplier who was able to handle the complicated design, and the design has worked splendidly for us. And it brings up a couple of key points to make. You know, we are moving fast, and I have a very strong innovation pipeline. So one of the differences that we mentioned earlier between vendor, suppliers, and partners was their ability to be flexible and to innovate. So for us to be successful, we need suppliers who can frankly keep up and demonstrate those types of qualities and characteristics. Otherwise, we won't be successful. And if you don't mind, let me go back and just talk a little bit about both of those suppliers and make a final point. The one who successfully helped us implement our incentive design now markets the ability to handle complicated incentive designs to other employers. So it was a win-win for them. And just because the other supplier couldn't do it certainly does not make them a bad company, and they have lots of wonderful people there. I want to make that point. But even for the suppliers, they have to understand that they aren't going to be able to invest in all the solutions that employers may ask them to do. Frankly, they have hard choices to make as well in which areas they're going to spend their very precious R&D dollars.
In virtually every IBI study of employers, we find that data and results are always a challenge. Chris, how do you know that your programs have had an impact? What have you measured?
You know, Tom, there's several ways to measure success. I think I'd like to start with the one that I think is the most powerful, which is an actual employee story and testimony. Remember I said earlier that there are real people behind the numbers. Let me tell you about an employee situation that touched my heart personally. Unfortunately, this person's not able to tell you themselves, but I remember the situation very well. We had a supervisor who had an employee who was having a tough medical condition that they were dealing with, and brought them to the service center that we had constructed for the benefit of our employees, and because they didn't know where else to take them. So we helped that employee deal with the immediate need that they had, but in doing so, they were exposed to the practitioners and clinicians that we had in our resource center. And the employee, being a little bit comfortable at this point, began to talk with the pharmacist about some of the medications that they were on because they had high blood pressure. Well, the pharmacist, after having counseled them related to how to perhaps even more economically purchase those medications, referred the employee to our health coach, because at the own employee's admission, they acknowledged that they could use a lot of weight. So after having worked with the health coach, they got, again, very comfortable, because trust was being created and relationships formed. So that health coach actually referred the employee to our on-site EAP counselor, because the employee made the health coach aware that they were also suffering from depression. And in this own employee's words, it's really dramatic. They indicated, you know, I don't have to take high blood pressure medication anymore because I don't have high blood pressure. I changed my lifestyle, lost weight, and would you believe I don't have near as many down days as I used to. Now, let's take a step back from that real circumstance and employee experience and say that's exactly the type of employee experience that we want to have as an employer, and as a great measure of the success of the employee experience and the way that our suppliers can work in a very effective way as they integrate their products and services. This is the type of employee experience that we want to hear about. It's a win for everybody, the employee, the family, the employer, the supplier. Everybody wins in this scenario. But I'd like to go a little bit further and say, you know, on a personal note, once you have seen an example like this, and as an employer experienced a life being changed, your life's really never, ever the same after that. And that's why I'd like to ask everybody in the audience just to take a moment, think about somebody in your workplace that you truly care about, who you know suffers from one or multiple chronic conditions. Think about how you can help through effective supplier management and investing in the hard work that's necessary to see it done effectively, how you could help change that person's life. And think for a moment how you might feel knowing the difference that you've made in that individual's life. In many ways, this is all about taking control of what we have as an employer and working hard to make a difference for the very people that we serve. I can't think of any other function in any company as an employer that gives its team this type of advantage. It's truly unique, and I really want everybody in the audience to make the most of the opportunities presented to them.
Chris, we find that employers always look to other employers with experience to help them in new endeavors. How did you begin your journey?
Tom, as a part of that total health and productivity strategy, we look at the employer as the focal company. The focal company, being the employer, is where all of our supplier services funnel through before they are received by our employees through the form of benefits. And to help us organize our thoughts in this area, we've created a roadmap. We wanted this to be something that we could follow and sort of chart our course and our journey, if you will. And Tom, this next chart that I'm going to show you really tells you at the highest level what we think it takes to execute a world-class supplier management strategy. The first area is in inventorying contracts, defining suppliers, and services. Somewhat of the basics, if you will. And that leads to the next step of determining and validating your service level agreements. The third area of focus is tracking and reporting, which produces a lot of information in which we need to, in Part 4, build a governance structure. Finally, in the fifth part, negotiation, implementation, and continuous improvement are detailed. And Tom, what I'm showing you here in this chart is really the roadmap at its very highest level. In the Part 2 of our DVD, we have as a tool this roadmap with far greater levels of detail for any employer to pick up and begin to understand what their journey might look like and what their roadmap would entail.
Who were your key partners as you developed your roadmap?
Tom, we were very fortunate to have one of our pharma supplier partners, Johnson & Johnson Healthcare Systems, come in and provide some support to us initially. They had gone to great lengths to prepare a document related to supplier management that provided terrific thought leadership for us. It was about a half-day session where a couple of their company representatives and our team, the broad team, all met together to go over the materials. And it helped us identify the gaps that existed in our roadmap, at least the first iteration, and how we could effectively close some of those gaps. I think that's an important point because if you'll You'll never have a better management system unless you have pressure tested it and figured out where your gaps really are and then work to get those gaps completed. You know, another partner in your organization's credit has been IBI. Ever since I've joined the company, we have been using the tools that exist within IBI to help us. One of the very first tools was the Health and Productivity Snapshot. It gave us a very quick look with limited information about what we could expect related to these 27 chronic health conditions that we covered earlier. And we followed that up with the HPQ Select, and we found it very easy to add the 4 questions of that instrument onto our existing health assessment, which gave us validated self-reported information from both our employees and their spouses. And that combined with the benchmarking tools that exist within IBI gave us great industry validation of where we were related to our short-term and long-term disability programs and FML and workers' comp. So all combined, IBI has been a terrific partner in the process of really getting started.
What other tools and resources did you use or did you develop yourself?
You know, Tom, we took everything that we had available and pulled it together to justify our case for investing in the supplier management services and support that we have created within the team. And we realized that if we were going to be effective, that we had to create somewhat of a practical framework of how we were going to get started. So as a part of that overall internal discussion, we've created a couple of items that I'd like to share with you. Tom, the first is our getting started checklist. You know, there's about 8 steps or so here that we have focused on. I would consider them somewhat of the basics. And as you really look through this list, and I'm not going to read through them, I would look at them really as just being a whole lot of common sense. And we think that we'll be most successful when we ground ourselves in things that are simple and that are straightforward. Completing these 8 steps will give any employer, I think, a high probability of having a very successful supplier management program. And to increase the employer's confidence in working through these 8 steps, we've created several tools and other resources that are downloadable from this DVD. And Tom, I'm going to show you those in the next chart. As we look at the supplier management tools that we've created and are making available in this DVD, I think it's, even with the first glance, clear to see there's a lot of resources that have already been invested in creating helpful, practical tools that you and your employer benefits team can use to quickly establish supplier management as a core competency within your team. We've tried to hit this from a number of different perspectives, and a little bit later we'll cover all of these tools in much greater detail. But at this point, I'd like the audience to recognize that we have a very comprehensive set of tools. You don't have to use every one, but as you look through these tools, you'll find that there's, depending upon how sophisticated and how quickly you want to establish your function, you'll see a tremendous amount of benefit in spending time and getting more familiar with these tools.
Chris, what are your key lessons learned that will be valuable to other employers starting this journey?
Tom, I'd be happy to cover those with you. If you don't mind, I'm going to cover those in a chart because I've listed them down. The first lesson learned is that employers must drive relentless attention to the employee experience. You know, almost like a treasure chest, tremendous value is locked up in each employee touch point. And success of today's high-performing total health and productivity strategies are dependent upon how well we can effectively maximize the value delivered through the employee experience. But the second one is that supplier management needs to be a core competency for the HR group. It's our intent and objective for the whole DVD that this would enable employers to accomplish that rapidly, having looked at all the tools and listened to this part of the DVD. The next point I'd like to make is that although there's lots of suppliers, and it's a very complicated landscape that employers have to work through, really your top 10 to 15 suppliers probably account for 90% of your spend. So don't let yourself be paralyzed into inaction by the magnitude of the problem. Focus on the critical few first and just get started. Which really brings us into the next part, which is that for employers to be successful, they have to be willing to share their strategies. It makes no sense in a partner-like atmosphere to retain those strategies. Let your suppliers know who they are, know what your strategies are, so that you can together try to own those problems and work successfully. You know, Tom, the next point in lesson learned is that employers are really in the power position and able to manage the healthcare supply chain to improve the real value of health benefits experienced by our employees and their family members. And I think this is a key point because many employers, I believe, perceive themselves to be somewhat at the mercy, if you will, of their suppliers, not thinking that they have the opportunity to really impact change. And I think just the opposite is true. The next lesson learned is that this is really good for all sizes of employers, small, mid-size, and large, regardless of what your workforce is. You know, sometimes employers might think, well, hey, I'm not a large employer, therefore I can't really impact change. And here's a couple of thoughts around that. It's really always, my experience, harder to turn a large battleship, and really speed and agility, which is what the smaller employers and mid-sized employers bring, can often be even more valuable. Because often, because of those characteristics, they can drive innovation more effectively. So all employers have their sets of pros and cons, but I have, through the two employers we've been speaking from, those experiences, found both to be very successful. Tom, the next lesson learned, I would say, and I think this is a real important one, is that coordinating suppliers is not an all or nothing situation. The most important thing for suppliers to do is to get started. And we've certainly teed up the complexities and some of the challenges here, but having gone through this with two employers, I can tell you the most important thing is to get going and getting your roadmap prepared and getting along your journey as quickly and effectively as possible. And then to start that journey, my final point and lesson learned is that to please sit down as an employer with your suppliers and watch this DVD. Ask questions, challenge each other, make it win-win, and together I'm certain that you will have a winning supplier management strategy.
Chris, final comment to the audience?
Tom, our goal for Winning Together was to help employers quickly establish supplier management as a core competency within the benefits team. These core competencies will help employers invent success every day and help before it hurts. You know, without struggles, there's no prize. And I'm certain that the hard work that the employers will invest in developing their supplier management strategies will truly change lives and produce results that drives business success. I'm grateful to the teams that I've supported to develop our supplier management experiences that we've shared with you today. And it's from those experiences that I know this journey to be very exciting. You know, Tom, I would wish for everybody here, as they're out there with their own journey, to have a lot of fun with it. And my final comment is that I would wish everybody in our audience the greatest success in winning together.
I want to thank Chris McSwain for sharing his knowledge and experiences with us today. I'd also like to thank Johnson & Johnson Healthcare Systems for supporting this program. But I also want to thank you, the audience, for sharing your valuable time with us today. And we hope we've contributed down this path to a new and exciting journey.